Good afternoon. I'm David Anderson, and I serve as chair of the Behavior Analyst Advisory Committee of the Kansas Behavioral Science Regulatory Board. I asked the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic media. Jacqueline Lightcap.
And I believe
Kimberly.
she's currently absent.
Okay, Kimberly Becker.
Here.
Thank you. Allison Bell.
Here.
Claudia Dozier.
Here.
Linda Heitzman Powell.
Here.
Emily Kessler.
I believe she is absent right now.
Pete Peterson.
I'm here.
Christy Marie Steele.
Present.
Mike Wassmer.
Here.
And Alice Jean.
Here.
I note the following BSRB staff members are also present. David Fye.
Here.
Leslie Allen.
Here.
Next, David Fye will read a message concerning this meeting being held remotely.
This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individual is requested to provide public comment. Because we are conducting this public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to the meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of the KOMA are not suspended. Therefore, we'll be conducting this meeting pursuant to the KOMA. On August 23rd, 2022, we sent notice of the advisory committee meeting to all individuals who had requested notice of advisory committee meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other media material will be posted on the board's website, and those have been posted on the website for review. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and the YouTube channel that allows members of the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And Dave, the conference call line is active, and I checked. There are no individuals currently on the line, but if I hear someone beep over, I will let you know.
Thank you, David. The meeting is now called to order, and the advisory committee will begin its discussion. First item will be approval of the agenda. Has everybody had an opportunity to review that? I must apologize. I too have had a last minute issue come up and have to be off as close to 2 o'clock as possible. So we'll try to move as efficiently through this agenda as possible. If so, I would accept a motion to approve the agenda.
I'll motion to approve.
Thank you. A second?
I'll second.
Thank you. All in favor, say aye or raise your hand. Perfect. Next, we will have a review and approval of the minutes. Everybody have an opportunity to review those. So, heads. Any changes, additions to the minutes? Seeing none, I would accept a motion to approve the minutes as written.
I'll make the motion.
Thank you, Pete. Sometimes people make motions and forget that they're muted. Second, please.
Second.
Thank you. All in favor, please say aye or raise your hand. Very good. Thank you all. Next, Dave will have his executive director's report.
Thank you, Dave. I'm going to provide a few updates to the advisory committee on a few items relevant to the work. First, we are still under some of the governor's directions related to the pandemic. Some of those restrictions involve avoiding in-person meetings, and so we are going to be having most of the board meetings and advisory committee meetings that continue to be held remotely. But we are looking to see if those restrictions are going to be changing, and if they do change, we will let you know about those modifications. Currently, one of the main issues is adequate spacing for attendees of meetings, and so because of that reason, primarily, we're continuing to do most of the meetings remotely. Also, another update by statute, all agencies are to submit a budget. We submitted a revised budget for the current fiscal year 2023. Additionally, we submitted a proposed budget or a budget request for fiscal year 2024 and fiscal year 2025. As part of the budgetary process, those are going to be reviewed by the governor's office through the division of the budget. And then in the first week of January, usually the governor's office comes out with recommendations on all state agencies' expenditures. And then the spring, the legislature goes through and holds budget hearings and then makes further adjustments to those requests. So we did submit our budget prior to the statutory deadline, and we'll be waiting to see if the office has any recommendations on changes. I wanted to let you all know about a few updates from the last board meeting that took place on September 12th, 2022. The board did have a handful of individuals provide presentations. One was from a company called CE Broker, which provided the board with some information on an alternative method for handling collection of continuing education hours, and also for us handling some of the auditing of those hours when individuals renew for license. So the board did not make a formal decision. They were just collecting information, but there was a presentation. And so if you want to see some of the information on that, I'd recommend going and viewing that portion of the meeting from the last board meeting on September 12th. Additionally, the board received some information from a representative of the Heart of America Professional Network on impaired provider programs and resources that could be made available to the board if the board decided to pursue an impaired provider program. The main ways that some agencies and some other individuals in other states use programs like that is they open it up for practitioners to voluntarily become part of that program if they struggle with substance use or also mental health conditions. Or in some cases, agencies have used those as an alternative to certain discipline if there is issues involving a complaint that might also cross over into those areas. So the board collected some information. It'll be reviewing information and have the opportunity to ask additional questions, but that is something the board is looking at right now as well. I mentioned the board does review complaints against practitioners and holds investigations. As part of that process, the board has an investigation policy, and that is used by the Complaint Review Committee, which is a subset of the board that reviews those complaints. The investigation policy is currently in the process of being reviewed, and the board is making some updates and changes to that policy. The board made some further changes on September 12th, and it is estimated the board will likely conclude their changes at the next full board meeting in November, and then changes to that investigation policy will be posted on the board's website. Additionally, the board seeks to hold an offsite annual planning meeting. This year, the board is going to be having that meeting. It's going to be in Olathe, and that's going to be on Monday, October 24th. So that meeting on Monday, October 24th, will be a full day meeting for the board. One of the main priorities for that meeting will be looking at items possibly for a legislative agenda for the board. And then following that meeting, I'll be making arrangements to talk to a member of the Reviser of Statutes office, and we can start to put together some language to request in bill form for the 2023 legislative session. I'm going to provide some updates on legislative items as well. First, I was presented testimony recently at a legislative committee on September 27th. There is the Robert G. Bob Bethel Joint Committee on Home and Community-Based Services and CanCare Oversight. And that committee met on September 27th. And one of the items that they were looking at that day was reviewing some of the past recommendations from a committee that met during the 2020 legislative interim and also the 2021 legislative interim. There was a special committee on mental health modernization and reform, and some of those recommendations had concluded, but some were left open. And so the committee asked for some updates from agencies that were connected to some of those recommendations. We were not one of the lead agencies on any recommendations, but they asked me to provide some testimony on work that the board has done specifically related to topics such as workforce issues and also telehealth standards. I will be in front of another legislative committee on October 18th. That will be the Joint Committee on Administrative Rules and Regulations, and that will be to go through some of the regulatory changes the board has recommended. Specifically, some of these relate to supervision and other items that connect to some of the items that were passed in bill form during the 2021 legislative session, and there's a handful of other items too. Those proposed legislative changes are on the board's website under a section titled Proposed Regulations. Additionally, we had put out some notice about those proposed changes in the Secretary of State's publication, the Kansas Register. We will be holding an open meeting to collect any kind of oral comment on those regulations on Tuesday, November 8th from 10 a.m. until 11 a.m. at the board office. Additionally, in the publication notice and also on the board's website, there's some information if individuals want to submit any written comments for the board to consider prior to those regulation changes being implemented. So with that, I will go ahead and end my report and I can answer any questions.
Thank you, Dave. Anyone have any questions?
I have one question about the remote working. So I know we're still remote working, but I just want to ask if in the future the working conditions change, would there still be an option to join remotely? Just thinking about the traveling to Topeka and how that might impact our schedules or the ability to meet.
Yeah, and I can talk a little bit about what the board has talked about and also what some of the advisory committees have discussed too. So right now with the restrictions, having in-person meetings is much more complicated. But prior to the pandemic, the board did have some meetings held remotely. So that is still an option. I think it will just be open for more discussion and it'll be more of a matter of preference. From what I have heard, it sounds like most groups may want to have an occasional meeting in person, but a lot of individuals have spoke positively about the convenience or the ability to have more members present because of lack of commute time. So that's definitely something that can be discussed. Right now, we're sort of in a holding pattern until we get further direction. But once we get the information that we can have more flexibility with the in-person meetings, then I think the advisory committee can probably have more conversations about what its preference would be on those types of things.
Thank you. It's good to know we still have some flexibility.
Thank you for raising that, Alice. If there aren't any further questions, we'll move on to old business, continued discussion on unprofessional conduct regulations. And so each of the advisory committees had been asked to review the unprofessional conduct regulations for their professions this year. Some of the advisory committees have just gone through their unprofessional conduct regulations to look to see if any language needed to be updated or clarified, or if any of the regulations were perhaps outdated and suitable to be removed. At a past meeting, one of the members of the committee presented information about some of the ethics code for the BACB and talked a little bit about some of what's included there. It was also noted that some of the terminology is a little bit different because in our regulations, we identify things that would constitute unprofessional conduct, whereas with the BACB, they have a list of things that constitute more or less professional conduct. And so at the last meeting, it was asked, is there a way to use some of the items that were included in the BACB language? Could we use some of those items and then would they be suitable to be unprofessional conduct? And I think some of the preliminary conversation is that there are items that could be professional conduct that might be seen more as best practices. And then there are items that could be, general practices that may not be preferred, but they wouldn't constitute unprofessional conduct. And then there would be things lower that if someone did it, we would want to find that to be a violation of unprofessional conduct. And so I think at the last meeting, some of the members of the committee had talked about looking through some of those items and then maybe coming to this meeting and sharing some additional thoughts on those.
And so I just wanted to open it up if any members of the advisory committee had additional comments on those, or when you went through some of those, if you had additional thoughts. And if you have anything in a certain form you'd like to share, I can definitely open it up so you can share your screen to go through that. But at this point, maybe that would be the best approach, is just to open it up and see if individuals had some additional comments on those areas.
I can go. So I unfortunately had to email David because I was like, I don't remember what I volunteered to do. And then I sort of racked my brain and I think I remembered it correctly. So I'm going to share a couple of things. So first, Christy, I used your chart, which was extremely helpful. Can everybody see the chart? And so I believe I had the section BACB codes not referenced above, and there are a lot of them. And so I went through I'm going to stop sharing that for a second and share our actual, let's see. Let me make sure I have the right thing up now. The Bsrb behavior analysis unprofessional conduct document. So I went and read through this, and this is oftentimes quite a bit more general, and the BACB guidelines are way more specific. And I think these are written generally for a purpose, so we don't have to go back and change these every single time one little thing changes in the guidelines for the BACB. But a couple of things stuck out to me that I think cover a lot of things. So they're highlighted here. One is that a violation is if anyone has been subject to any other disciplinary action by any credentialing board, professional association, or professional organization. And so that sort of, I think, is like a catch-all for anything that's not specified in here. So that's one thing. Another thing is H, offering to perform or performing services clearly inconsistent or incommensurate with one's training, education, or experience, or with accepted professional standards. So I think that's also sort of a catch-all that takes a lot of things into consideration with respect to our practice. And then the last one is essentially practicing using services that are not warranted by the client's condition, their best interest, or their preferences. And so these three in particular, I think, really took into consideration some of those ones that Christy had that weren't necessarily coded. But in addition to going through that and sort of pointing that out, I did go through Christy's chart and sort of cross-referenced and looked at these things. What's highlighted in blue are things that I suggest could be added. And then over here with a comment, I suggest where they could be added. Let's see. So for example, let's get back to where we were. For behavior analysts are accountable for their actions, and they take appropriate actions to address any, problems or issues. This one I suggested could be added after M because it's sort of getting to that. And so just a clause could be added with respect to that. There isn't discussion about professional development within our current Bsrb unprofessional conduct. I didn't know if that was because we have a separate requirement for CEs for you to have, continuing education to continue to maintain your license or for your license renewal. But we could add sort of a clause about that after BB in our current unprofessional conduct. And then in addition to that, adding in additional information that they're also responsible for professional development with respect to cultural responsivity and diversity. After the discussion about practicing, providing services that are not discriminatory. And then there's nothing in the current unprofessional conduct about accepting gifts. And so that one I suggested could be added after S because it's talking about fees and monetary stuff. And then for a lot of these other ones, I just sort of wrote a comment that these are all very specific things that I think if we included all of this stuff, it's going to be a huge document. And so I think that they are covered, or the spirit of them is covered in various other sections. So with respect to clients' rights and needs in service delivery, I thought section EE of the current unprofessional conduct mentions that. With respect to explaining things to people using understandable language, there's several sections of the current unprofessional conduct document that contain information about explaining to certain clients or stakeholders and pertinent information. If we just add in the comment that it needs to be in understandable language, I think it'll take care of several of these. And then as you go through, I'm not going to go through each one, but as you go through these, I sort of discuss how I think it's already covered, or the general issue is already covered in other sections. And it's sort of piecemeal. It's not all together, but like this part of this might be in EE, and then this part of this is in MM, but I think the general flavor is there. And so I'm not going to go through all of those. Yeah, let's see the other ones that are blue. There is a lack of information in the current unprofessional conduct regarding supervision and training. And that's relatively newer stuff in the ethics code. So I do think there are a couple of sections that talk about supervision and training. I do think there are some things that we need to add in regarding what would be considered unprofessional conduct with respect to supervision and training. So taking on too many supervisees and those various kind of things I've highlighted here in blue that we can add after MM, which talks about supervision and training. So I do think a supervision and training section needs to be developed. All of these are supervision and training.
Okay, thank you, Claudia. And we can come back.
Yeah.
I just heard a couple of beeps on the conference call. So if there's someone on the conference call, could you go ahead and state your name so I can get you down in the record? Okay. Well, if I hear them beep again, I will let you know. But I didn't want to cut you off with that part of the presentation, but I thought your comments were really helpful. I just wanted to make sure we got the person who was on the phone. But yeah, some very, very helpful comments on those. And I appreciate you going through that and identifying those things. It's really, really helpful.
Yeah, I think there are things in our BACB ethics code, like Christy said, there are things of what we should do, but I don't necessarily think they're like things that are like violations. They're good practice. And I think a lot of things are already covered, but just in different places in our current unprofessional conduct. But I do think there are pieces here and there where we can add some wording, particularly in that supervisory section, supervisory and training section. Does that make sense to everybody?
It does. And Claudia, really what I want to say is I appreciate you looking at it and giving the broad overview, right? I tend to get lost in the details, just like I think most of us behavior analysts, because that's where we live and practice. Right. And so it's really hard sometimes making that transition to the umbrella. You did a really good job at making me feel comfortable that the spirit of what we try to do when we oversee each other is captured in the current regulation, with the exception of a couple of places, particularly supervision.
Supervision.
Mm-hmm.
Yeah. Okay, good.
Thank you.
I'm glad. Thank you. Well, if anybody else has any other suggestions, or if they're adamantly opposed to sort of how I was framing it and what I'm thinking, please reach out, because I'm more than willing to take feedback on that.
I agree with Linda as well that this is super helpful and makes me feel very comfortable too, kind of how you framed it and pointing out the parts where we might be able to pull in the professional conduct guidelines or ethics code based on what we already have written in the unprofessional guidelines. And I absolutely agree with you that supervision training and especially the cultural competency as well are newer initiatives of areas that we need to be competent in as well and practicing ethically. I think it would be awesome to, David, if you're willing to share your document with the comments and kind of like, I think that this speaks here to the spirit of the code, that might help us later on down the line, and potentially even the folks who are reviewing potential violations, disciplinary action in terms of like, why didn't we include this, or where do we feel like this is incorporated into our guideline?
Yeah, I can share both documents. So one is our actual Bsrb BACB regulations, and what I did was I inserted comments where I thought we could add something from the BACB ethics code. And then the other document was your document, Christy. And what I did was I used the comments function in that Excel document and just added in a comment as to if it's blue, then I think information should be added and where I think it should be added. And then if I didn't think information needed to be added, it's not colored, but there is a comment in there where I think in the current regulations, it's the sort of the flavor of it is already there.
Yeah, that's awesome.
So I can just send those directly to you, David.
Yeah, go ahead and send them to me, and then I can distribute them to the rest of the members of the committee.
Cool.
But thank you again for all of your hard work on that, and that is going to be really helpful, I think. I also wanted to let Dave know Jackie Lightcap has entered the meeting, and so I have her down on the attendance roll as well. But yeah, in terms of that document, yeah, go ahead and send it to me, or send both of them to me, and then I'll go ahead and distribute them to the rest of the members of the committee. And talking with the other members from the advisory committees, I think there was kind of a hope that maybe some of the unprofessional conduct regulations could be in a format that could be sent back to the board after the December advisory committee meetings. So if we think we have some information suitable at that time, that could be really helpful. So.
And I would also echo Christine, Claudia, both of you. That was really very helpful. And also just to acknowledge that oftentimes the language is written kind of broadly, just because we know, right, you can't capture every single little thing. And I appreciated your alluding to that and saying, the spirit of what we want in our practice is captured in this language, because yeah, if we tried to include every single thing, you're right, the document would be 80 pages long. And that's all Leslie and David would ever end up doing is editing those documents, right? Anyone else have any feedback?
I know, Christy, you probably have a lot to share. So do you want to go first, or I can go first with the record keeping? Mine should be pretty brief.
I'm fine with,
you can decide.
I'm fine with you going second, just so it'll feel better to have 2 out of 3 down. But
okay.
Before
because I know you have the habits there.
Before jumping in though, Alice, Linda, in the so I took on the where the areas where the unprofessional conduct guidelines for the Bsrb, how they compared with the BACB and the Missouri guidelines, and potentially making suggestions for changes in that area. And so I had asked, I recruited Linda, and she graciously offered feedback as well on those. Linda, you did put in some comments related to the area that Claudia covered. Did you want to touch on any of the feedback that you gave in that domain before we move on, or do you feel like she covered?
I feel Claudia, you made me feel really comfortable because And it's also social validity, right? That more than one of us like pick up on the same thing. So I'm good with it. Christy, thanks for giving me the opportunity to do that. But I just think that that if we address those two areas, supervision, training, and cultural competency, and capture that somewhere, I think that I like the language and the spirit of things. So,
Cool.
Thank you.
All right, then Alice, take it away.
Okay, sounds good. I think barring what Claudia said, it's like, I felt like our regulation did a pretty good job in terms of being inclusive and covering a lot of the things. And then comparing to, in terms of the record keeping, I felt like Bsrb is too brief. And then the Missouri one has a lot of details. So I felt like in general, we're kind of in between, so which is good. But there are several things I want to just bring it up so that we can have a conversation. And again, thank you so much, Christy, for creating the Excel document. It is very helpful.
I second that. Like, doing this was so much easier because we had Christy's document. Like, I would have gone down a rabbit hole if I didn't have Christy's document. So it was a lifesaver.
Yes,
Very welcome.
absolutely. I totally agree. She did a lot of the heavy lifting work here. So again, on the left is the Bsrb current language, and in the middle is Bsrb, which is very brief. And then I think this column is the Missouri one. So I think in general, ours really did a great job compared to Bsrb. There's one thing that I felt like maybe we can have a conversation about in terms of record keeping. So with Bsrb, they were saying that when a behavioral analyst leaves an organization, those record keeping responsibilities remain with the organization. But we didn't touch that here in our document. And I don't think Missouri guideline touched on that either. So as a clinician myself, this would be a really important question for myself. Like, you know I'm supposed to be keeping all those records, but what if I leave that organization? I think in general that should be leaving with the organization, but the way that at least the Bsrb is framed right now, it implies the responsibility is under the licensed behavioral analyst. So that's the first question. And should we discuss before we move on to the next question, or maybe I can just state all of them and then we can have a discussion? Do we have a preference?
I have a preference. Can we discuss them line at a time?
Yeah, sure, we can.
The only thing with this one is that, when a behavior analyst leaves an organization, these responsibilities, I'm going to try to find that row 68.
Mm-hmm.
Because what happens if so what happens if, like, I start an organization and then I dissolve that organization? Right?
Mm-hmm.
Those records have to be maintained somewhere. So
I can see that scenario, and then the problem with that is that if that organization is not there anymore, I feel like the clinician should be keeping those records. But
right.
If a clinician leaves an organization while the organization is still there, I don't think that the organization would allow the clinician to take the records away.
Correct.
So, that's a very interesting scenario.
It's a conundrum. So, and it's only because I've been around long enough that I've seen that happen.
Mm-hmm.
And then And then conversely, when a consultant leaves an organization, but they take the client with them, even though the billing or the initial treatment was under the organization of origin, if that client transitions, and of course, I've seen the other thing too, where the client transitions with the consultant and the organization refuses to release the documents. I mean, even in our field, sometimes we have people that are not as professional as we would want them to be. So just coming back to the ability to be broad enough that it encapsulates different scenarios without having to spell out each potential scenario.
What are other people's experience or solution with different scenarios? I'm curious to know.
In my experience, if it's related to supervision of RBTs or Bsrb certificates or trainees, I'm keeping that information with de-identified client data when I leave an agency. But oftentimes in the contract, in your job contract, you have to agree that you'll dispose or return any PHI at when you leave the company. And so I think this inclusion can be important in just clarifying that the behavior analyst is not responsible for maintaining these documentations if they're legally bound to return that information to the company and to not hold on to it.
I think that's the key, Christy, is that that it does, is the right word, indemnifies the behavior analyst if the requirement is that the documentation remain with the agency.
I think that's a really good point. So if they have contracts saying that you have to return all this information, then then the clinicians should just, give those to the organizations. I don't know whether that would solve the problem when the organization dissolves. So then the clinician didn't take that responsibility, I assume.
This seems like more of a larger medical industry question.
Yeah.
Of what happens to this information when an organization closes, but I don't think that would fall on the individual behavior analyst unless they were the owner of the company.
That's true.
Agreed. And it actually says that in it clarifies that in the Bsrb record keeping things. It clarifies that if the licensee is the owner or custodian of client records.
Yes. Mm-hmm.
Awesome.
Row 73. If the licensee is the owner or custodian of client records, license. Yes.
So maybe including the same wording as that in the BACB, or noting that if the behavior analyst is not the owner or custodian of client records when leaving an organization, that the responsibilities remain with the organization or the custodian.
I agree.
Mm-hmm.
So maybe just adding that sentence here.
Mm-hmm.
Yeah. Okay, good discussion. And then the next thing, I think we can have a discussion kind of related to what Claudia mentioned is the supervision piece. So the Missouri one definitely talked about maintaining records of supervision, which I don't think is discussed here. So because of, if we're gonna add like more supervision content in general, I think it might be helpful to add supervision in terms of record keeping as well. That's another suggestion. The Missouri one definitely has some language there we can use if we want to add some language there. The next thing is, again, Missouri one has a lot of details. I'm gonna move their document here. Can you all see the documents that
Yes.
have highlights?
Yes.
And I'm trying to enlarge it, but it looks like my computer is not working. So anyway, so they have a lot of details about what those records are, which I felt like ours did a good job trying to include everything, but not being like, you know, being a long list there. But there are some information here related to, like, for example, the Missouri one asked people to even document and keep record of the fee arrangement and their documentation of discussion with the client, things like that. And it reminds me of another discussion that I had with Linda in the past about what is that law that now requires we have that discussion with, we cannot surprise patients with a bill. So I don't know whether, because of that legislator, whether there is any need for us to be more specific to include that. Because as a clinician, I wasn't thinking that that is my role to discuss the cost with the patient.
There's information about that in the other document.
There is?
Yeah, so in the document that's not the record keeping document, like the major Bsrb, unprofessional conduct, there's information in there about fees and discussion of fees. So I think it's probably
great.
Okay.
I'm glad that was, yeah, now I remember we had that discussion in one of the meetings. So then that's not a problem anymore. So I think that's the major things that I felt like after reviewing. So to summarize, I felt like maybe we can add the record keeping related to behavior analyst versus the organization, and maybe potentially adding language related to supervision for this part of the document. Any other questions or suggestions with record keeping?
Sounds good.
Okay, Christy, your turn.
David and David, I just want to check in. It sounds like some people had to leave earlier than 2 p.m. So what is, or 3 p.m. What is are we able to go until 3 to discuss? I don't think it'll take that long, but do we have a timeline when we can no longer meet?
I think we'll probably have to close the meeting around 2 o'clock. So we probably just need to be able to spend about 5 more minutes on this topic. And then we can quickly kind of go through the last items on the agenda. And then whatever we can't get to today, we can just kind of circle back around to at our next meeting and pick up from there.
And we'll be able to share all these documents, and so everybody will have a chance to look at it and review it.
Yeah, if you can send those to me directly, I can send information out to individuals after this meeting, and then bring back comments to the next meeting, and then we can kind of go over those at the December meeting.
Okay. And David, you were saying that you were hoping to get like finalized recommendations for any edits by the December meeting.
I think that would be the hope. If there's still items that need some additional work, that's okay too. We don't have a hard cutoff in terms of, these could be put into place during the year at any time. whereas statutes would need to go in front of the legislature during a specific time period. But I think the goal was is to, as much as possible, to have recommendations ready from the December meeting that the board can look at those to start at the new year. If there's items that still need to be worked on further, there can always be some later requests for adjustments too.
Okay. Given that we need to end early, I'd like to show folks the updated spreadsheet in terms of what my recommendations are, or what I wanted to discuss with everyone, and then Linda's too. And maybe, you know, I can show you guys that. And then since we don't have enough time to discuss them, I put in here, can I share my screen?
Sure.
I'll just show you what I'm talking about. Okay. Anyone can't see?
I can see.
Okay, so this is the same document. It's just got some new columns in it. So on the left side is, just like before, the exact unprofessional conduct guidelines as we have them, as they're currently written. Column B, where my recommendations are what I asked Linda to look over and what I would make to the board in terms of adding or modifying the current conduct guidelines. Column C is Linda's feedback in terms of her opinion and her recommendations. And then I just added in column D, which what I was planning is that we could kind of take these recommendations row by row and then kind of determine, yes, we want to move forward with this in clarifying or adding, or no, we're happy with the way it is. And then the columns to the right are as they have been in the previous versions that have been sent out. So David, if you feel like we have 5 minutes, I can just briefly go through what my recommendations were, or if we don't have that time, then we could potentially just send this out to the group to review and to have, you know, something to look over before December, and then we can discuss them in December. Do you?
Dave, do you have any comments?
Yeah, I think you can proceed.
Proceed? Okay. Okay, so I'll just touch on mine, and then Linda has hers over here, which we can look over. But this isn't necessarily an alignment, but in coming at this as a clinician who's, you know, not a lawyer, but also fairly well versed in ethics codes, areas that I think could help flesh them out to be more accessible to our licensed behavior analysts. So I really appreciated the Missouri conduct guidelines stated the purpose of the conduct of the ethical rules, provided definitions of relevant terminology, and stated that the BACB code will be used to clarify ambiguity. And in light of what Claudia said earlier in this meeting, maybe we don't need to say that because of what's already included. But that's a recommendation that I have. I think that would make these guidelines more accessible to practitioners and really understanding what they're being held to and what the consequences could be.
I definitely like the addition of sort of like terms and definitions, because there are some that are used in there that it would be helpful to provide people. I do agree that given that the current BSRB regulations sort of they're so broad that if you've had any violations with respect to any of these other entities, that includes the BACB. I don't think we need to mention the BACB in there.
Okay. My next one is, I think, really the biggest one of the changes that I would suggest is that the BACB and Missouri only require that you self-report if an ethical violation if you have committed an ethical violation or become aware of one that you yourself have committed, whereas the BSRB requires that if you are aware of anybody else that has violated the guidelines, that you must report them. And so I think if we do choose to keep it this way, we should have a very solid discussion or, evaluation of whether that's why we're deviating from both Missouri and the BACB in this regard. So that's on there.
And the only thing I want to say about that is that I don't think it should be a requirement, but I think it does need to be a suggested course of action, because when I see somebody else not engaging in what I consider professional or ethical behavior, I want to know that I can, as a suggested course of professional action, contact the Bsrb. If the only thing in there is self-report, then that kind of neuters our ability to police ourselves as well. What do you think, Claudia?
So, well, I mean, so remember, the way that the Bsrb unprofessional conduct is set up is these are violations of your license, right? So, and the way, what I kept on getting confused by is that the BACB ethics code and the Missouri one these are ethical codes. These are things you should do, right? So I don't think it's a violation if you don't report somebody, right? And remember, that's what the Bsrb codes are violations. Do you know what I mean? They're not telling you what is best practice, which best practice is, like in the BACB codes and stuff, is they suggest that you report people if they're not doing things right. Or they suggest ways to handle it. So I don't know if I would change that. Or add in, I don't know if I would add in language that would suggest that if you're wanting to align it with the BACB, then it should just be self-reporting and not say anything else about reporting from other people. Although I thought the BACB ethics code, and maybe they changed it in this last iteration, I thought the BACB ethics code suggested you are supposed to report people for ethical violations.
Yeah, I thought it did.
I can look back into that for December and follow up in terms of if I can find anything. And of course, if you guys do as well, that'd be great. I know that they have a method for reporting others, but there's like a very clear TA of when to do so. And I didn't see anything mandating that you report if they violated the ethics code.
And I think it's okay that the Bsrb doesn't align with the BACB with respect to that. If we think other people should be reporting folks, do you know what I mean?
Yeah.
So I don't think we're married to the BACB one. And I kind of like that,
Yeah, but Claudia, that we don't have to adhere to BACB. And also, I wonder, like, we should look into other disciplines that, like psychology and things like that, and see whether they support that or not. Because I feel like if we're only relying on self-reports, I don't know how many people would report.
Right. But we need to really think about the consideration that these Bsrb regulations, these are what is considered a violation of your license. And so do we want someone to be considered a violation of someone's license if they don't report somebody else for doing something?
Right.
That's a violation. So I think we really need to think about that.
I think
if someone knowingly doing that, like knowingly someone already committed something that is unprofessional and unethical, but choose not to say anything or taking any actions, I felt like personally that would be a violation.
Yeah, and I think like in the BACB code, I'll have to look back, but from what I can remember, it's that you're supposed to sort of address it with the person such that they can rectify the situation and potentially, if needed, self-report themselves. That's sort of the action that's suggested from what I can remember, but I don't know if they made that change I don't have these newer codes memorized like I did the old ones. yet.
I think you're right, Claudia. I think the step is approach the other person, educate them as to the violation, encourage them to correct it. And then if they continue to do that, then it's to report. And I think it's to decrease spurious reports to the BACB because somebody, stubbed their toe and still went to a session, right?
I'm gonna need to interrupt you all. It's a fantastic
right.
discussion. In order to get to the 3 issues on our agenda under new business, but is it my understanding then you all will share this, what you have with Dave, and he'll send it out to the rest of the group. And then in December, we will plan to finalize the recommendation to the board. Is that right, Dave?
Yeah, I think that's the goal. So let's plan on doing that. Go ahead and send me materials, and then I can distribute them out to the committee, and then we can try to, as much as possible, come to a decision on some of these items at the December meetings. So that way they can be forwarded to the board, and the board can look at them to start the year next year.
So David, do you guys have the manpower, the person power to take what Claudia did and what Christy has done with some of the recommendations and then my suggestions and merge them into one document so that then we're all looking at one document that has all Claudia's notes in it. It's got Christy's columns in it. And then we would have the ability then to look through that and put our comments. I don't know if you have the bandwidth to be able to do that or not.
And honestly, I'm not sure at the moment.
All right,
But
that's fine. It was a pie in the sky hope.
I will try to do that. I might check in about a month before the meeting and then just kind of see where I'm at and then follow up with members to see if I need some additional assistance on that. So.
Yeah, and that would be awesome. Also, if the manpower isn't there and Claudia and Alice, if it's fresh in your brains, an option could be that since we've kind of come to agreement on those 2 sections, plugging what you've suggested into the unprofessional conduct guidelines the way they're written, and that way we could potentially in December just review those, give it the green light, and we could focus our energies on the ones we haven't discussed yet.
Good, thank you. On the new business, Dave.
Okay, and I'll cover this topic very quickly. I'll just go ahead and share my screen here. There is an issue with some regulations or some statutes. So we talked about statutes are passed in law, regulations are things the board has more authority over. For most of the professions, including the behavior analyst profession, there's a statute that essentially gives the board jurisdiction or authority to impose certain disciplinary remedies or items when things have been violated on practitioners. So, for example, this is a statute for the marriage and family therapy profession. And the highlighted text there essentially says that the board may refuse to issue, renew, or reinstate a license, may condition, limit, revoke, or suspend a license, may publicly or privately censure a license, or may impose a fine not to exceed $1,000 per violation upon finding that a licensee or applicant for license, and then it has a list of different items. And one of the items in that list talks about if there's been a violation of the unprofessional conduct for the profession. Alternatively, the similar statute for the behavior analyst profession is KSA 65-7504. And this statute says the board may deny, suspend, revoke, or refuse renewal of a license issued under this act if, and then there's more detail there. The main issue with this is legal counsel for the board is going to be seeking for the board to make a change on this item because right now in statute, whereas most of the professions allow the board some flexibility for disciplinary remedies when someone has violated unprofessional conduct, which could include things like a small fine or public censure or different things like that. The current statute for the behavior analyst profession really only allows for denial, suspension, revoking, or refusing to renew or issue a license. So it leaves the board with very few disciplinary remedies. So if someone violates the unprofessional conduct, you might have to do something as extreme as suspend a license or revoke a license or do nothing. And so there's no real middle ground there to do a small fine or to do censure or something like that. So legal counsel for the board has asked for a change to statute to go ahead and make this provision in statute for the behavior analyst more in line with the other statutes for the other professions, to give the disciplinary committee some more grounds to have appropriate remedies when a violation has occurred.
So there would never, can I ask a question?
Sure.
Given the way that our the unprofessional conduct regulations are written right now, there would never be a case when someone that their license has been suspended or revoked from the behavior analysis certification board, but a lesser penalty is put in place by the Bsrb, which would result in them still being able to practice under their license.
So if something were to happen from the national accrediting body, and then the board was informed about that decision, the CRC would review that and all the details involved, and then would make the determination about what disciplinary remedy was appropriate. So it's kind of on a fact by fact, case by case basis. But currently in statute, they're limited to what they would be able to do for the behavior analyst profession based on what's in statute for that profession currently. So
I believe that you have to have a current BACB license or certification in order to hold a Bsrb license. So if it was suspended or revoked, the board would might have to take it as well.
Yeah, so I wanted to bring this statute before you, let you know that the board will likely be considering a change to this, and it will be going in front of the legislature next year. I know at the previous meeting, there had been some discussion about would the profession want to really look at changing a lot of the statutes and regulations for the profession. But I think given this item, the board is likely to want to go ahead and make a change to make it consistent and to make sure that there are some appropriate remedies available. So just wanted to bring this before you all to see if you were supportive of that change before the board really has a full discussion on it and to take action.
So just to speak to the what Claudia said was, like, if the BACB revokes my license, right, and then Leslie pointed out that at that point, if the BACB revokes my license, then the Bsrb would, since I have to have that license, then it would be they would revoke my LBA. But if it doesn't raise to the threshold that the BACB would want to revoke my license or pull my credential, then the way it is now is either the board has to go all out or nothing. Whereas if we did the change, then the Bsrb has the potential to do an intermediate penalty. Is that correct?
Right. If this was changed, went through and was approved and put into law, then there would be some different types of remedies that would be available to the board, not just for violations of unprofessional conduct, but also violations of the other items that were included in the statute. So. Yeah, I mean, I think in this case, we would not want to have the complaint review committee left with no option and have to do something very severe if it would be a seemingly minor violation. So I think this is something that will be helpful to make it consistent with the other professions, but wanted to make you all aware of it first before the board has that discussion, just so you would be aware of that change and why the legal counsel had recommended the board consider this. So.
All right, one more question. So you said that this is going to go in front of the legislature for
Correct.
approval?
Right, because this is part of the statute that gives authority for the board to impose discipline.
Right. So when that happens, does that open the entire statute back up?
So any
Good
changes,
question.
I mean, any changes could be made to any of the statutes. There's separate statutes based on different parts of the act. So this would be one that would just involve KSA 65-7504.
Okay.
Okay,
So they couldn't shut down the entire law.
I mean, you could always have an amendment where someone could pull in another statute, but the only real statute that would be changed based on this purpose would just be the 65-7504. And so that would be the one that would be included in the bill if it was going to go before them in a bill form.
Okay.
And-
The only reason I asked that is because that used to come up a lot when we were wanting to make changes to the statute, because there are definitely people in this state that do not want us to have a licensure bill.
yeah. And so then the follow-up question is, if there were any attempts to add additional statutes to the bill, would we be informed as a committee first so that we could counteract that? Or potentially, right? Or,
The tricky thing is these things happen very quickly sometimes.
mhm.
I mean, often it could just be someone who has an amendment in a committee. So I think that based on what I've seen before in legislative committees, there's really not a lot of time when changes are made. But I think, this specific change for this reason, I think is pretty understandable as it relates to, making sure we don't want to have too stringent of disciplinary remedies, having those the only ones that are available. So.
All right, any other comments before we move on? We've got two more issues and we've got to do them quickly.
My question may not be relevant, but I'm thinking about these punishments that would be doled out for these violations, and to me, it's unclear why there would be a monetary fine, what the purpose of that fine would be, but maybe that's not a discussion for right now.
Well, and I think sometimes those fines could be if someone does not renew their license on time, there could be a small fine, or if someone is short of their continuing education hours when they renew. So there could be penalties that are a bit more, maybe not as severe as other penalties, or a bit, smaller. And so sometimes it could be possible that that's more of a suitable determination of discipline than something as versus something like a public censure or something like a suspension of license. Yeah.
Okay, that's helpful. Thank you.
You ready to move on, Dave?
Yes. Mhm.
Okay.
And the next item talks about, this is something that the board had talked about. It's under new business item B, discussion of possible regulation for care of clients in crisis. And Dave, do you want me to talk about this one, or do you want to kind of explain some of the background of this item?
Yeah, I can give a quick explanation. So again, under the unprofessional conduct, we know that most licensed Bsrb professionals make arrangements to provide care, be available to their clients who are in crisis. And if they're not available, they have somebody in their practice, or they contract with somebody who's available to do that. We have discovered that some groups simply have a answering machine that says call 911 or go to the hospital or call an agency that they don't have a relationship with, which puts those groups in a very difficult position. So we're talking about adding language which would require people to have some kind of formal arrangement to deal with clients who are in crisis. Is that enough detail, Dave?
I think that's helpful. Yeah.
And I apologize if you hear kids in the background. There's a playground outside my office. It's fairly active right now.
I'm sorry. I feel like I talk too much at these meetings. The only concern I have with that is like you're talking about like a behavioral crisis, right? So if I only see kids that are like 2 to 5, I may not need a formal policy for a client that may be contemplating suicide, which would be a crisis, right? Because I don't deal with that population. So requiring that I have something formal on a formal process for potential crises for, even though I'm working with clients that have autism, I may not deal with that in my practice.
I was
So,
thinking,
yeah, I don't
oh,
think
sorry.
I don't think
Linda,
it's-
I was thinking more like crisis within, say, elopement. Maybe a child runs out to the street or is, maybe needs restraint or SIB, severe SIB.
Mm-hmm.
Yeah, I don't think it's not suicide specific. It's more of if a client is in a self-defined crisis. So if a parent was at a point in dealing with a child that you were working with, what is the availability for them to contact somebody who could help them between that point and a next session, or to help determine what, I mean, sometimes absolutely somebody needs to end up going to an emergency room and being screened in particular situations, but not in every situation. And that's what we're trying to avoid.
So I'm going to be a little egocentric here instead of broad. And I'm going to say that if I have like on the answering machine, it says, if this is an emergency, hang up and call 911. Right? However, if it is an emergency, like Kim, like elopement or whatever, there's a hierarchy. There's a direct relationship between my families wouldn't be calling the main office number. They would be calling their consultant. And I suppose if they couldn't get in touch with one of their service providers or the consultant or the director of clinical services specifically, they might call the main office number.
No, that's really what this is that there's a plan in place that
Okay.
that your patients, your clients understand who they're to contact when they're in that kind of crisis, so that they're not left just guessing and then calling and then getting sent to an emergency room or to another group that doesn't know them professionally and have a plan in place for how to respond to that.
And so what's the regulation on that? Is it that people have to submit their plan for, I mean, I guess I'm not understanding.
It would be the professional's responsibility to understand that they have a duty to those folks and that they have some kind of arrangement, so that if a person contacted the Bsrb and said, I'm in services with this person, I was in crisis, and I tried to contact them and there was no one there and I was just referred to 911, then Bsrb would have the opportunity to investigate that, contact the practitioner and say, this complaint has been made. Now the practitioner says, no, I have a very robust plan in place and here's how I do that.
But isn't that already covered under like JJ, where it says failing to to seek continuation of service, or abandoning or neglecting a client under or in need of professional care without making reasonable arrangements for that care?
It has been interpreted, but that's what we're trying to kind of, part of what we try to do is make sure professionals know what they need to do in order to practice in a manner. When these issues have come up, BSRB has had a discussion at the board level about this. That's what they would have said. We would assume that falls under kind of abandoning your client. But again, we would like to make it as clear as possible to practitioners what their responsibilities are.
Is it
Yeah, and I
expected-
think go ahead, Christy.
Is it expected in the other professions that the BSRB regulates that they will also always have someone on call that's familiar with the client if they're in crisis and address that immediately?
And that's exactly what we're talking about, is the board is going to be talking about whether this would be something it would put in place for all licensees.
All licensees.
Yeah, this isn't an issue specifically to your group.
Okay.
Because it's not the case that all providers provide those kind of services in our field. So some people provide the services in the context of a preschool, and that's when service provision's given. Anything that happens at home, that's another provider, right? So I think this is tricky with our field because it depends upon the population, the environment in which you're providing the services, that dictates like what your crisis plan might look like. So if I'm providing it in an early intervention program at a daycare or a preschool, then I might have some crisis prevention, like how are staff supposed to respond if crisis happens when they're at the preschool? But once they go home, we aren't an outpatient clinic. We don't provide that kind of services. We don't provide in-home services. So we wouldn't be responsible for any crisis plan that happened once they were outside of our doors. Does that make sense?
Yep, makes sense to me.
And as a sole practitioner who does work in home with clients who sometimes have severe behaviors, small agencies, individual practitioners, that would potentially push some folks out of practice because of the cost of either having someone else on call who's familiar with the client or needing to be on call constantly 24 hours a day. That's not something that is feasible for an independent practitioner.
I agree. And also I feel like I'm still a little bit confused about whether it's required that as clinicians to create a plan, like, here's what happens if there's elopement happens at home. Here are the actions. If you cannot be able to do that yourself, call this person, that person, call your friends or whoever to come and help you, versus that we as clinicians need to be like available when those crises happen to provide support. I guess I'm not clear on whether it's which one we're talking about or we're talking about both.
Dave, you got any help in clarifying that? I think it is being responsible for, again, because if you say, yes, I might have a patient who then gets in a crisis, then who are they to go to? How is that group supposed to respond to them in an ethical manner if they've not been providing care?
Mm-hmm.
Much like my doctor is not on call 24/7, but somebody's responsible for his patients to manage that until he is available again.
I think that it could be reasonable to require, just like we have transition plans and discharge plans for our clients, that there's a crisis plan that the behavior analyst assists in spelling out with the family in the case of severe challenging behavior. So that could be call 911, make sure that we're coordinating care with the doctor or that the family has the relevant skills to take the child to the emergency room or call the police if necessary and advocate for their child, but not necessarily, or the client, but not necessarily to require that the practitioner is on call at all times. And I think what you could risk in this situation is that one, providers don't provide services to this population, or they don't take on clients that have these severe challenging behaviors. And then you're in a place that's even worse for that client because their options are call 911 or go to the police, and they're not getting any services because practitioners don't have the resources to support this regulation.
Yeah, I
certainly-
think there are two things about our field that are actually pretty different than other fields with respect to how we provide services. Most of us provide services, not like an hour a week of therapy. We provide services 15 to 40 hours a week for the clients that we work with in sort of a patient setting, or we might go into their home and do that. But we're already with them a ton of times. So there's no like outside time that we can be available for those things. So that's one. I think the second is most of us work with the population of people who engage in severe behavior disorders. So this isn't like a crisis that happens once a month or once every 6 years. Like crisis can happen for these folks multiple times a day. So if we're present, we all have a crisis plan written for that 30, 40 hours a week that we work with those individuals. But outside of that, for a lot of us, it's outside of our purview to create a crisis plan with families. They should have medical professionals and other people that work with respect to that. So I don't know. I think this might just involve a longer discussion than what we're having today.
I agree.
Because especially like, has already been said, we deal with a population that has the potential for multiple crises a day, in which case we have a function-based behavior intervention plan in place, and people have been trained on that, caregivers, providers, et cetera. And so, yeah, I think it's a longer discussion.
I think too that maybe I think it's a good idea to advise behavior analysts and folks in similar professions that this type of crisis plan and establishing with the family or client is necessary, and so that they aren't just calling 911 or showing up at an emergency room where someone doesn't know the client, and also fleshing this out potentially more with our profession specifically of what that might look like and what's feasible within the bounds of the practice that we provide.
Appreciate all your feedback. We've run quite a bit longer. Dave, do you want to try to hit your last item?
Sure, and I can keep this pretty brief. At the last board meeting, the board indicated they want to name a more permanent member. The board is able to appoint one individual to serve on the Kansas Fights Addiction Grant Review Board. And I had sent out an email to you all back on September 29th. Each of the advisory committees for the board received a similar email. The board indicated they wish that their appointee would be a member of one of the advisory committees for the board. Specifically, the statute that authorized the Kansas Fights Addiction Grant Review Board 75-778A11 talks about having the appointee be an individual who has expertise in the prevention, reduction, treatment, or mitigation of the effects of substance abuse and addiction. And the board at the last board meeting talked about they would like their appointee to be the ideal candidate would be someone who has a strong expertise in that area, which could include significant knowledge on substance use and addictions and experience treating addictions. There's no sunset for when that group would stop meeting, but that group has already started meeting a couple times. I was the initial appointee for the board, but I think now that that group is going to be meeting more currently and more regularly here in Topeka, they're looking to find a member of the advisory committees to serve on that. So that has to be a member of one of the advisory committees for the board. They're looking for someone who has that relevant background. If you are interested in serving in that capacity, per the information in that email that I sent out, go ahead and send me a letter of interest and a resume no later than Friday, October 14th. And then I will be collecting all of those and then providing them to the board for their review so they can make a determination, the more permanent appointee to that board. So just wanted to remind you about that, and go ahead and feel free to contact me if you have any more questions about that.
Thank you, David. In regard to the prior issue, if I'm correct, Dave, the board is asking for some input from the advisory committees about what the language would look like around that.
Well, on the Kansas Fights Addiction Grant Review Board, it's made up.
No. The prior issue.
Oh, as far as the care of clients in crisis?
Yeah.
Yes. So the board was asking the advisory committees to discuss that item for any specific language on that topic, and then to provide back comments to the board on that topic.
So maybe that's where we take this next time, is for you all to be thinking about what that language would look like for your particular group.
Do you have any samples or drafts that you could share with us in terms of the language that the board is thinking about considering?
I think we will.
Okay.
And
That would be helpful.
Next meeting. The agenda, Dave, says December.
Right. There really hasn't been a particular date that the advisory committee has met. Usually it hasn't been, like the second Tuesday or the third Wednesday or something like that. So I can go ahead and send out a poll to all the members to try to identify a date that has the least conflicts, and then we can go ahead and get that scheduled after I hear back from everyone.
That would be perfect. All right. Thank you all very much. I would accept a motion to adjourn.
I'll motion to adjourn.
I
Thank
second.
you. Second. Thank you very much. Appreciate your participation. We'll see you all in December. Have a wonderful fall.
Thank you.
Right. Thank you, everyone.
Bye.
Bye.